Hello, my name is Kai Kreitz, and I'm a member of the Thunder Bay Accessibility Advisory Committee, representing people with mental health and addictions disabilities. In the following video, Jaymee Martin will provide you with some really helpful tips and information, including what is mental health and why should we talk about it? What affects our mental health? How do we cope with stress? How can we take care of ourselves, and what resources are available?
Hi, my name is Jaymee. I'm a community social worker here in Thunder Bay, specializing in mental health. Today, we're looking at mental health versus mental illness, what impacts our mental health, and how to cope. Mental health is a state of psychological and emotional well-being. We all have it. It's not just about surviving, it's about thriving. It's enjoying life, having a sense of purpose, and being able to make life's highs and lows. Good mental health allows you to feel, think, and act in ways that help you enjoy life and cope with its challenges. Mental illnesses are described as disturbances in thoughts, feelings, and perceptions that are severe enough to affect day-to-day functioning, such as anxiety or mood disorders. 1 in 5 people in Canada will experience a mental illness in any given year. 70% of the mental health problems have their onset during childhood or adolescence. Good mental health might look different from one person to another, but there are 6 common factors of well-being: a sense of purpose, strong relationships, feeling connected to others, having a good sense of self, coping with stress, and enjoying life. Mental illness affects people of all ages, education, income levels, and cultures. However, systemic inequalities such as racism, poverty, homelessness, discrimination, colonial and gender-based violence, among others, can worsen mental health and symptoms of mental illness, especially if mental health supports are difficult to access. Certain factors may increase your risk for mental illness. Stressful life situations, like a global pandemic, isolation, financial issues, divorce, death, job loss, or abuse, ongoing chronic medical conditions, and biological disorders. 50% of Canadians reported worsening mental health since the pandemic began, with many feelings of worry and anxiousness. 1 in 10 state their mental health has worsened a lot since the pandemic started. Substance use is on the rise in Canada. During COVID, 25% of Canadians 35 to 54 and 21% of those aged 18 to 34 have increased their alcohol consumption since social distancing and self-isolation has begun. COVID-19 has had major effects on our lives. Many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in adults and children. Public health actions such as social distancing are necessary to reduce the spread of COVID, but they can make us feel isolated and lonely and increase stress and anxiety. Stress can cause the following: feelings of fear, anger, sadness, worry, numbness, or frustration, challenges in appetite, energy, desire, and interest, difficulty concentrating and making decisions, difficulty sleeping or nightmares, physical reactions like headaches, body pains, stomach problems, and skin rashes, worsening of chronic health problems, worsening of mental health conditions, increased use of tobacco, alcohol, and other substances. Remember to take care of yourself and be kind to others. We're in this together.
Thank you, Jaymee, for that important information. I hope you'll find these tips and resources helpful.
This presentation has been provided for the Thunder Bay Accessibility Advisory Committee's virtual open house December 3rd, 2021 by Jaymee Martin, RSW, MSW, Children's Centre Thunder Bay social worker. Please contact your local mental health agency, such as the Canadian Mental Health Association, www.cmha.ca, for more information and resources. If you are in crisis, please call 1-833-456-4566 toll-free. In Quebec, 1-866-277-3553, 24 hours, 7 days a week, or visit www.crisisservicescanada.ca.